When did you last hear a clacking typewriter, see a dialing land phone, use a dial-up internet or floppy disks to store data, or even listen to a portable CD player? You know the speed of technological change, and that we now have deeper understandings of how systems work. I introduced technology and techniques that could make amputation dentistry nearly obsolete in Avoiding the $6,100 Death Spiral. There are ongoing worldwide discussions concerning conventional medicine versus alternative medicine, conventional dentistry versus biological dentistry. Is there a meeting ground? Of course, and I see it happening this way. When physicians and dentists or their children begin having first-hand health issues, they show up in biological dental offices with a lot of questions to which they want answers. Often, they seek to have their mercury-laden fillings removed in a safe way because they don't feel they are healthy for themselves. They are also starting to question the wisdom of root canals, cavitations, and other concerns biological dentists address. These physicians then take the answers they find out into the world. In this way, we all push the limits of what we know to explore the possibilities of greater healing. We all are beginning to appreciate the role of dentistry in the health concerns we manage personally and treat, perhaps helped by the growing awareness of all kinds of interrelationships in our natural world. How we farm and produce food, how we promote pharmaceutical answers at the expense of treating underlying health problems, the carbon footprint of our lifestyles, and so on. As one older dentist mused recently when he referred a patient with medical issues likely tied to mercury poisoning, "I don't know much about this biological dentistry, but I do know it took 100 years for medicine to accept basic hand washing and the validity of blood pressure. Maybe you all have something here." In the end, changes are driven by consumer choice. There's a choice over here and a choice over here. Both have answers. What do you want, Mr. and Mrs. Consumer, for your children? Do you want this, or do you want this? This one won't challenge your body or pocketbook as much as this, but in the end, it's up to you. Air abrasion and ozone dentistry versus high-speed drills is one choice. Seeking biomimetic dentistry to replace failing traditional dentistry versus more of the same is another choice. Even treatment choices for a child with ADHD can be more biologically sound. Most parents choose to treat their children with pharmaceutical drugs to slow them down. They do not realize a possible underlying cause is related to mouth breathing, perhaps from unaddressed allergies, and poor oral posture. Since mouth breathers breathe at twice the rate and volume of nasal breathers, they expel too much carbon dioxide. Low carbon dioxide causes muscle excitability and tension, as well as poor sleep quality. To make matters worse, mouth breathing leads to a three-dimensional contraction during facial development, in turn leading to crowded teeth and a negligible airway in 2 dimensions. Thumb sucking and other poor oral habits can also cause a three-dimensional facial contraction, as these incorrect and unbalanced forces mold the face during development. Among other things, thumb sucking can create an open bite and a high narrow palate that impinges on sinus and eye orbit space in the face, as well as the tiny airway I previously mentioned. It can also artificially, but permanently, draw soft tissue from the palate down into the airway. This contracted development of the head and neck makes the airway vulnerable to collapse during sleep, called apnea. Once lost during early development, the airway requires heroic measures to correct after age 12 or so. Dentistry and myofunctional therapists have answers you can read about on my blog, Facial Meltdown, Birth to Death. In the end, it is up to consumers. Do you want to help guide correct facial development at an early age? Or do you want to address downstream health consequences later on with extensive orthodontics, drugs, CPAPs, and so on? Making better informed decisions through consumer awareness is the intent of my work and book called Mouth Matters. This video, released in tandem with the Avoiding the $6,100 Death Spiral video, helps explain a few concerns biological dentists address. After all, health-savvy consumers recognize that ignoring a mercury-safe protocol while removing mercury-laden amalgam fillings to save a tooth with a biomimetic restoration is counterproductive to long-term health. There are two common understandings the biological dental community addresses: mercury filling toxicity and fluoride toxicity. As they say, the dose makes the poison. Most of us are bombarded with both. The privately held trade organization we know as the American Dental Association originally contended that the mercury making up at least half of each silver filling is stable. In other words, it does not vaporize out of fillings. Now they officially insist that only about 0.03 micrograms per day of inorganic mercury vaporizes from a silver filling, though there seems to be no evidence to back that claim and much to refute it. It is known that the highest body burden of inorganic mercury comes from mercury fillings. The Environmental Protection Agency, the World Health Organization, and other sources estimate vaporization rates of about 3 to 21 micrograms per day. That is from 100 to well over 700 times what the Dental Association contends. The estimated daily absorption of mercury vapor for a person who has 8 one-surface fillings, such as you see here, is 10 micrograms. This is likely a lowball estimate. The World Health Organization asserts there is no safe level for mercury exposure. If you have mercury amalgam fillings, chewing delivers an average of 68 micrograms per day, and brushing delivers about 272 micrograms a day. Placing an amalgam filling releases about 2,000 micrograms of mercury vapor, while polishing or removing one releases roughly 4,000 micrograms. How is it possible to think that you can stay within safety limits if you have mercury-laden fillings in your mouth? Industries use Jerome mercury analyzers to measure workplace mercury levels and thus protect workers from unsafe levels. For years, I wondered why someone didn't televise a Jerome mercury analyzer measuring mercury vaporization from amalgam fillings. Finally, in 2013, Dr. Oz did, showing the public what studies have been showing for years, though he was vilified for it. One doctor said this about Dr. Oz's piece: "It's good to have voices of conventional dentistry in this forum, if only for perspective. Many of us go through different stages of understanding throughout our lives. For dentists, our university training is just the first stage, but many will not move far beyond its limitations. Recent graduates often feel empowered with their new knowledge and training. Others are humbled at their safe beginner status and by the realization of how much they don't know. Dr. Oz assuredly goes beyond his original training to move medicine forward. This is likely why he did the piece. Mercury is the most dangerous of all the heavy metals, and it modifies the distribution and retention of other heavy metals. Worse, our bodies have no mechanism to actively excrete mercury. As a heart surgeon, Dr. Oz may be outraged at heart and blood vessel damage exacerbated by mercury. A review called The Role of Mercury Toxicity in Hypertension, that is, high blood pressure, cardiovascular disease, and stroke by Mark Houston, examined mercury's relationship to heart disease. This bullet list summarizes many of the ways mercury damages blood vessels and the heart. If you haven't yet seen the mercury-filling vapor emission video or the University of Calgary's video about nerve degeneration after mercury exposure, you owe it to yourself to check it out. Testosterone is a hot health topic. Heavy advertising suggests many men's lack of energy, sex drive, and strength may be due to frighteningly low levels of sex hormones, euphemistically called low T. However, if testosterone therapies have damaged a man's health, he should contact any number of law practices specializing in this. What's a guy to do? Well, first a man may want to look at the reasons he may have depleted sex hormones and address root causes instead of symptoms. While there are many, let us look at the feminizing hormones, especially estrogen, rampant in our current environment. The disappearing male? Xenoestrogens are fake estrogens or estrogen mimickers. They are concentrated hormone-disrupting chemicals found in our food, soil, and air. These look-alike estrogens attach to estrogen receptors in our bodies, interfering with our body's natural, circulating hormones. They disrupt menstrual cycles, affect prostate health, contribute to problems with fibroids, endometriosis, uterine cysts, and polycystic ovary syndrome, and can damage ova and sperm. No doubt about it, you can't avoid plastics from birth onwards. Plastics are probably the most famous source of these gender-bending compounds. Almost all our food and beverages come wrapped or stored in plastic, is processed using plastic equipment, and is often heated in plastic containers. BPA is probably the most famous xenoestrogen, but even if a plastic is BPA-free, it likely has phthalate esters and PCBs, both of which are dangerous endocrine disruptors. But they can be found elsewhere, for instance as 4-MBC in sunscreens, parabens in our lotions, makeup, and creams, and the preservative BHA in food and cosmetics. And how about those synthetic hormones excreted by the millions of women who take either birth control pills or hormone replacement therapy that are flushed and then recirculated back into our drinking water? Needless to say, our society is inundated with foreign estrogens. Lest you think men suffer from excess female hormones exclusively, take a look at the problems both men and women face as our culture bows to the convenience and perceived simplicity of our modern foods, fertilizers, herbicides, pesticides, cosmetics, dairy products, meat, pharmaceuticals, and recycled water. So let's look at dentistry's contribution to the problems men and women both face when we enjoy the convenience of environmental hormone sources. Sulfates in toothpastes are xenoestrogens, both sodium lauryl sulfate and sodium laureth. And these decorative little brown, green, and yellow plastic specks in some toothpastes, added to improve product experience, are actually polyethylene plastic balls. Another estrogenizer, triclosan, is an antibacterial agent found in toothpastes and soaps and is estrogenic, as is nitric oxide, and the dye in the plaque-detecting pills and liquids. Our composite sealants, resins, some splints, and temporaries contain BPAs and other estrogenic plasticizers. But when I present to dentists or to the general public and mention mercury is an estrogenizer, the room noticeably stirs. It seems very few people realize this. However, mercury is best known as a neurological poison. How do biological dentists handle the mercury problem? There are many options and considerations. Our bodies are bioelectric entities. Each cell type has an optimal frequency range in which it operates. 4 microamps is considered the maximum healthy electrical output in which the body can function properly. Natural teeth with no fillings typically emit 1 to 4 microamps of current. The brain and central nervous system operates on far less, 7 to 10 nanoamps. A nanoamp is 1,000 times less than a microamp. Saliva is an electrolyte. Mineral-rich, it carries current just as battery acid does. In this way, the mouth becomes a battery when we have 2 dissimilar metals in our mouth. Add the mouth's warm conditions, bacteria, and food debris, and it becomes an even richer electrical environment. Capacitors, like the flash portion of a flash camera, build up charge over a period of time and then discharge much of the stored current in an instant. In the same way, we can call fillings capacitors. A metal filling often generates far more than 5 microamps. The difference in voltage between what a filling produces and what the body can handle is like the difference between touching a 9-volt battery and sticking your finger in an electrical outlet as far as the brain is concerned. Upper tooth roots are less than 2 inches from the brain, so there is concern that adding this much excess electrical activity into the brain has the potential of creating misdirected impulses to it. The varying metals in the mouth produce a range of electrical potentials. Some biological dentists use a readometer to determine what the millivolt output of each metal filling is. The readometer is basically an ammeter. Electrical potentials cause galvanism and can contribute to oral lesions such as cancer, leukoplakia, oral lichen planus, and exacerbate toxic or allergic reactions from dental work. In people with amalgam fillings, potential differences of more than 50 millivolts are present between restorations, with potentials ranging from minus 417 millivolts to a positive 150 millivolts. Negative potentials are usually more pathological than positive ones. The average potential for metal crowns and bridges is 154 millivolts, and for brace brackets, 71 millivolts. With the use of a readometer, dentists can determine the amount of electrical current emitted by each metal restoration. The most electronegative fillings should be replaced first. By law, ambulances and hospitals carry activated charcoal for accidental poisonings. Every medicine cabinet should have some. That is because charcoal can absorb thousands of times its own weight in poisons. Ingested activated charcoal is harmless, and there are no ill effects when it comes in contact with the skin. It is rated Category 1, that means safe and effective, by the FDA for acute toxic poisoning. Activated charcoal is the most effective treatment for poisons. In fact, 1 teaspoon of activated charcoal has a total surface area as big as a football field. It is a good idea to take several tablets after a mercury removal session. Pre- and post-removal rinses, such as Dentacare, scavenge mercury from a patient's saliva. To pre- and/or post-rinse during a mercury filling appointment, mix 3/4 of a teaspoon in a glass of spring water. Swish for 60 seconds, then spit. Do not swallow. The EDTA ingredient in it binds heavy metals so you don't absorb them during mercury filling removal. Essential oils like myrrh and tea tree are anti-inflammatory and antioxidant. You can suspend other substances such as N-acetylcysteine, activated charcoal, or chlorella in water for the same purpose. Broken cell wall forms of chlorella chelate best. As far as protective gear is concerned, you want as much exposed skin and clothing covered as possible with disposable gowns and hair coverings. Filtration masks are a must. If dentists want less protection or to look less cumbersome, this mask is an alternative. Remember, a person takes in far more mercury through inhalation than through the skin. There are many options for covering the patient. Using an outside air source is one. A dentist should use standard high-speed suction, or even better, a cleanup suction tip that effectively surrounds the tooth. If it's on your glasses, it's in your lungs. The Denta AirVac removes dry and wet waste with a 4-stage filtration system. It handles mercury vapors from amalgam removal, bacteria and viruses from high-speed drilling, noxious chemical odors and volatile organic compound gases, dust from air abrasion and microetching, as well as the smoke plume from dental laser and electrosurge procedures. A slow-speed suction tip slid under the dental dam is a good idea. Most biological doctors do place rubber dams to isolate a tooth. They also slick the surface of the dam with a sulfur cream because mercury's high affinity for sulfur will help trap it. Nitrile dams are better vapor barriers than latex. For their own protection, dentists should slather sulfur lotion on their hands and arms before gloving as well. Opal Dam is a product that can improve the seal on the rubber dam. Mercury vapor diffuses right through the dam, and some of the particulates will sneak past it too. Another good reason to have a saliva ejector behind the dam to evacuate trapped mercury-laden air. A dentist reduces vapor by keeping the cleanup site cool with water and by taking out the filling in the largest chunks possible. She will continuously rinse, especially under the rubber dam clamp, because the amalgam particles left on the used dam will emit mercury from the garbage can. Again, it's important to remove mercury fillings in the largest chunks possible. As soon as the amalgams are out, the dam is removed and your mouth is thoroughly rinsed before placing the new restorations. It can take as much as 60 seconds of rinsing to fully remove the mercury vapor. The dentist should search for gray particles. If there are particles on the back of the patient's tongue, she should instruct the patient to sit up and gargle them out. And of course, every dentist should be responsible enough to the environment to use an amalgam separator of one sort or another to keep drinking water clean. Hopefully, the FDA will soon mandate this. You might ask where your dentist's vacuum discharges. Is it into a nearby utility room? If the vacuum pump discharges into an open trap or through its own base, it will likely pump mercury vapor into the utility room or lab. The International Academy of Oral Medicine and Toxicology's website is a good resource for further information and products. This ultra-carbon-based air purifier takes out much of what is in the air: chemicals, fumes, gases, and odors.
It controls particles with an optional HEPA filter rated at 0.1 microns. It is particularly useful for people with multiple chemical sensitivities or asthma or other respiratory challenges. The 160R2 air purifier is of all-metal construction and contains 7 pounds of activated carbon. As I've already discussed, carbon is an excellent purifier. A negative ion generator is another great air purifier, especially if it has a pitcher and a catcher like this one designed for dental office use. It scavenges all kinds of air pollutants, but especially mercury vapor. Negative ions have additional health benefits too extensive to thoroughly review here, though I'll touch on a few. Health risks can arise from a lack of negative ions. An abundance of them help increase energy and improve mood by raising serotonin levels. The particles themselves are just regular air molecules of carbon dioxide, oxygen, nitrogen, or even water that have gained an extra electron. This gives them a negative charge. The process of turning normal air molecules into negative ions is called ionization. It occurs naturally when air is influenced by energy sources such as sunshine, lightning, or even waterfalls. Negative ions allow you to clean inhaled air more efficiently. Cilia sweep noxious particles from windpipe and lungs. Negative ions increase cilial beating in your windpipe, while positive ions slow the beating. It has been known since the 1960s that negative ions help cure asthma and bronchitis faster than antibiotics and other drugs. Do you know anyone who gets cranky on an airplane or on extended car trips? As a plane or car slips through the air, the outer skin attracts positive ions. This draws whatever negative ions are in the cabin to the outer walls, so they are less available to the human inhabitants. The predominance of available positive ions in the cabin puts some people to sleep and gives others headaches. The FAA knows reaction times slow and vigilance decreases in a poorly charged space, and is concerned for pilots and those who work in traffic control towers. The atmosphere there is also unbalanced with positive charges because of all the electronic equipment. Mercury is an incredible oxidizer. I usually advocate for letting healthy foods provide the nutrients we need, as I describe in Mouth Matters, but sometimes supplements are necessary and mercury removal is one of those times. Vitamin C can fight back because it is a potent antioxidant. Many dentists recommend heavy vitamin C use before and after mercury filling replacement. Note, however, that vitamin C counteracts dental anesthetics, so delay taking oral vitamin C the day of your procedure until after the appointment. You can use this to your benefit by taking a high dose after your appointment to help dissipate the anesthetic. High doses of vitamin C help you eliminate well, as does magnesium. Eliminating well is key to removing a body's load of mercury. No point in chelating heavy metals if they stagnate in the intestines and reabsorb. Liposomal forms of vitamins are a good bet because the phosphatidylcholine that forms the double layers of nanospheres allow them fast access into cells. These are good brands of vitamin C because their oral delivery system avoids the fillers, binders, gelatins, capsule materials, dyes, sweeteners, and flavorings of most vitamin C supplements. Dentists should be particularly aware of the antioxidant glutathione. Glutathione's most important functions are commonly remembered with the acronym AIDE, or AID. A is for antioxidant. Every cell of the body needs glutathione to reduce oxidative stress to its valuable mitochondria. Mitochondria are the energy furnaces for each cell. since it takes 2 molecules of glutathione to escort 1 atom of mercury or other heavy metal out of the body. Many people are deficient in glutathione. This allows mitochondrial damage. Glutathione also recycles the antioxidant vitamins C and E and supports their function. I is for inflammation reducer. Glutathione regulates immune function in multiple ways, including the production of the mediators in the body that run the inflammatory show and also the various prostaglandins that suppress inflammation. There are strong correlations between low glutathione levels and health issues such as atherosclerosis, heart attack recurrence, asthma, hepatitis, cancers, Alzheimer's, respiratory diseases, malnutrition, and physical stress. D is as a detoxifier. Glutathione binds directly to toxins, preparing them for elimination. As mentioned, glutathione chelates heavy metals like mercury and binds to cancer-causing agents and other toxins like molds and the mycotoxins found in some alcoholic beverages. Most toxins are fat-soluble and thus become stored in fat cells. In order to eliminate them, they must be made to become water-soluble. Some people lack the enzymes that help match glutathione to toxins. Enhancing glutathione levels increases one's chances of toxin elimination. E is for energizer. High energy levels require a healthy heart. Because of its relentless beating, heart cells are prone to oxidative stress. Glutathione provides the antioxidants to reduce the stress. Sugars, the unrecognized American addiction. Oral conditions like gum disease reflect body-wide inflammation, and simple carbohydrates like sugar and flour products, which break down into sugar right in your mouth, contribute greatly to inflammation. Studies show sugar produces a state with neurochemical and behavioral similarities to cocaine and other powerfully addictive drugs. In other words, yes, sugar is an addiction. Sugar addicts can be born or made. Many people are biologically programmed to be true sugar addicts, but do not realize a chemical explanation for their sugar sensitivity exists, or that solutions are available. 66% of sugar addicts can kill their sugar habit by changing neurochemical pathways in the brain with glutathione. If there is alcoholism in the family, it is likely that this is the neurochemical pathway you share. Luckily, it is the easiest one to override. There are many good products that can boost levels, like Redisorb, Protandim, liposomal glutathione, and whey proteins like Immunical. If you choose a whey protein product, buy from a company that respects its fragility during processing, because heat and mechanical stresses degrade the bioavailability of the critical free cysteine molecule. Treat it with the same respect at home. Do not heat it or slip it into blenderized drinks. Stir or shake gently. Glutathione also helps you produce your DNA and scavenges and metabolizes cholesterol. If you take acetaminophen-based painkillers, you should also supplement with glutathione. Your body's glutathione decreases with age and statin use. It is a tough nutrient to absorb. I write about it extensively in Mouth Matters. Let's briefly review some of the ways a person can pull mercury from deep tissues and organs. Chlorella is central for systemic mercury elimination, since approximately 90% of mercury is eliminated through feces. Large doses of chlorella facilitates fecal mercury excretion through as yet unknown mechanisms. Chlorella also helps repair nerve tissues, improves digestion, promotes healthy pH levels, and normalizes blood sugar and blood pressure. You may pull mercury out of deeper tissues only to resorb it if you do not maintain digestive regularity during periods of mercury filling removal. Again, activated charcoal is a great detoxifier. Cilantro alone often does not remove mercury from the body. It often only displaces the metal intracellularly, or from deeper body stores to more superficial structures, from where it can be more easily removed. Some clinicians will periodically administer IV doses of DMPS and DMSA. Chelating heavy metals with these is tricky because it can also deplete other important minerals. You should know these compounds do not pass through the fatty membranes surrounding each cell, so they cannot extract mercury from within cells well. Yet mercury vapors are attracted to fats, so they easily slip through a cell wall's fatty membrane to live within. Once there, a cell's negative charge tends to hold on to positively charged mercury. An oral heavy metal chelator called MBMI is currently undergoing the FDA approval process. It seems to be an exceptionally effective agent at pulling and binding mercury safely from within human cells. To complete its winning profile, it is also an antioxidant and elevates glutathione levels. A commercial product should soon be available that is approved by the FDA. Vitamin E doses of 400 international units per day has a protective effect when the brain is exposed to methylmercury. 200 to 400 microgram doses of selenium is a particularly important trace mineral for mercury elimination because it facilitates glutathione function. Brazil nuts offer a great form of selenium. And of course, glutathione is a critical mercury detoxifier. Repetitive high doses of IV glutathione can be useful, especially in neurologically compromised patients. Studies are beginning to show there are some reasons to question the routine use of laughing gas because it inhibits the activity of methionine synthase, an enzyme involved in methylation reactions and DNA synthesis and repair. It may well have sustained effects on learning and memory, and it raises blood vessel wall damaging homocysteine levels. Beyond breathing oxygen for some time after using laughing gas, it may be wise to take methionine supplement and folate and B12 afterwards at the very least. Fluoridation is another hot-button issue for integrative practitioners. First, look at its position on the periodic table, something I ignored for decades. Topping the halide column, fluorine is the most reactive of all elements. As an oxidizer and inflammatory agent, there is reason enough to be wary of fluorine. Fluorine's pure form is a pale yellow corrosive gas. Take a minute to think of all the fluoride sources you know about. Chances are excellent you don't know it is a common ingredient in pesticides including post-harvest fumigants like synthetic cryolite, which is a sodium aluminum fluoride compound. I'll bet you didn't know that under current organic labeling standards, as long as a crop is grown or produced organically, it can be fumigated with cryolite or sulfurofluoride and still be labeled organic. Powdered eggs are allowed to contain 900 parts per million of the fumigant sulfurofluoride. About a third of all scrambled eggs are powdered. Sulfurofluoride is also used to fumigate flour, nuts, and many other foods. Tea, even before fumigation, is naturally high in fluoride compounds and can contain 700 parts per million. Bone is a target for fluoride, thus mechanically deboned chicken products can be excessively high in fluoride. Should we be feeding these products to our children? The FDA allows all food processing facilities, such as canneries, bottlers, dairies, mills, bakeries, and packagers, to fumigate to a 70 part per million residue fluoride tolerance. For most of us, because of water fluoridation, it is in our water. But because it's in water, it is in processed foods and drinks. These are often distilled down, concentrating the fluoride. How disappointing for all of us. Worse, overfluoridation likely only delays decay diagnosis that starts internally, while subtracting IQ points, damaging kidneys, calcifying the pineal gland, replacing iodine in the thyroid gland, and making bones more brittle, among many other complications reported by the National Research Council and ignored. Think about the wonders of enzymes for a moment. Enzymes are a cell's master conductor. 46 chromosomes reside in each cell's nucleus. There are 30 to 40,000 genes on each chromosome. Each gene contains about 17 inches of wound DNA. The 4 sugar bases that make these up combine to produce 20 amino acids. These 20 amino acids line up to produce the 20,000 enzymes that run about 100,000 chemical reactions a second. In other words, enzymes are the master chemists of cells. Cells work poorly when enzymes are unavailable or improperly synthesized. Enzymes also help kill pathogenic microbes and dissolve blood clots by breaking down collagen. One thing I bet you didn't know, fluoride irreversibly inactivates essential enzymes that use zinc. Methionine is essential for methylation, one of our body's most important and common chemical processes. Hundreds of chemical reactions require it, such as detoxing, making and using neurotransmitters, protecting the heart and blood vessels, reducing inflammation, and making and repairing DNA. People with autism disorders are notoriously poor methylators. Should they be exposed to fluoride to the degree that they are? And that's just the first enzyme on the list. No one can calculate their daily dose. Fluoride is the only chemical added to drinking water for the purpose of medication and is the reason most of Europe has rejected fluoridation. However you personally feel about water fluoridation, please be sensitive to others' concerns. There is a person at the end of every root. Root canals and jawbone cavitations concern many who pursue whole-body health. Here's why. A tooth is like a fountain. Each is a complicated living structure that requires nutrition, hydration, and internal cleansing. To that end, blood vessels, lymph, and nerves enter into the hollowed pulp chamber through its base. From the pulp chamber, highlighted in red, run miles of microscopic tubules, about 3 miles in a front tooth and perhaps more than double the miles in back molars. It is through these tubules that nerves and lymph flow, bringing minerals and nutrients to keep a tooth alive, strong, and flexible. Examining this image more closely, the dark filaments running diagonally downwards from the upper right-hand corner are bacteria invading these tubules. 12 to 13 microbes can fit side by side into each tubule, but the tubules are so small not even one white blood cell can enter to mop up the microbial invasion. Even if they could, some bacteria have mechanisms to foil these soldier cells. Whether bacteria enter the pulp through tubules from tooth decay or the pockets of gum disease, they eventually kill the pulp and the tooth abscesses. Usually, but not always, the tooth becomes painful and dies. It is at this point that traditional dentists recommend embalming the tooth with a root canal. They drill out an access to the pulp, sever the nerves in the pulp from their extensions into the microscopic tubules, remove them, and then with a series of ever larger files, they file away as much of the edges of the empty chamber as they can. Some use bleach, a laser, biocalyx, also known as endocal, or ozone in an attempt to sterilize the canal. After trying to disinfect a tooth, the main pulp channels are filled with an inert material. The ideal is to disinfect and fill to the base or apex of the tooth, but as you can see in this case, that doesn't always happen, and sometimes the canal is overfilled. Shrinkage of the material as it cools, underfilling, or overfilling are just 3 ways root canals obviously fail. It is an oversimplification that pulp chambers are always straight, that there is always just one per root, and that cleaning or sealing the miles of tubules can be overlooked. Straight A to B thinking works no better than a straight line laser or a straight file. The thin dark lining around each tooth is called the periodontal ligament. It is the shock absorber for each tooth during chewing. Unfortunately, chewing can pump oral microbes, and worse, their toxic wastes that remain within the tubules, the ligament, and the infected bone surrounding the dead tooth into the blood vessels in the area and the mouth. From here, they can travel virtually anywhere in the body, like joints, organs, and the brain. Dr. Boyd Haley, Professor Emeritus of Chemistry at the University of Kentucky, discovered that root canal toxins in the parts per billion range inactivate critical enzymes that quarterback every activity of our bodies. They inactivate or impair hormones and neurological activity while encouraging autoimmune issues. Haley is an expert on Alzheimer's disease and discovered that 2 important proteins are found in low concentrations in all those with Alzheimer's disease compared to those without it. Root canal teeth produce a waste product that annihilates these proteins 5 times faster than mercury does. A milder example, if you have mercury fillings, a root canal, and digestive problems, know that anaerobic bacteria in root canal teeth create poisonous hydrogen sulfide and methyl mercaptan gases that, when combined with mercury and other heavy metals, destroy digestive enzyme activity, eventually leading to a wide range of gastrointestinal problems. Some call root canal teeth more toxic than the botulinum toxin. In fact, unless a dentist uses ozone gas, he or she cannot sterilize a tooth with its miles of tubules. And because the perimeter of a tooth cannot be sealed, even with ozone, it is uncertain how long these tubules, or the bony socket anchoring it, stay sterile in a living environment. Most biological dentists suggest a range of 1 month to maybe a year. Sometimes the body tries to quarantine an infected tooth by forming a highly calcified bony wall around a root canal tooth that makes it look as though it is healing, when in fact the opposite is true. This is called condensing osteitis, and it looks super white on an X-ray. It can easily mask abscesses. A dense bony wall encasing a brittle dehydrated tooth makes properly extracting root canal teeth an enormous yet critical challenge if one is trying to regain health and has decided to remove all root canal teeth. Improperly done, they lead to equally poisonous jawbone cavitations like this one. Cavitations, which is slang for osteonecrosis, are areas of somewhat liquefied dead jawbone colonized by anaerobic bacteria and their waste products. Trauma, smoking, and diabetes can contribute to their formation, but improper extractions and clotting abnormalities are the biggest reason they form. Their toxicity is on a par with root canals, so it makes sense to also clean up jawbone cavitations when removing root canal teeth. Is it odd that cavitations, often resulting from dental procedures, are not recognized by traditional dentistry? Think about it. As a profession, we do better when we can point a finger to jawbone death arising from pharmaceutical drugs, like bisphosphonates, which are prescribed for osteoporosis or bone cancer, rather than pointing to our own profession. Testing a young oral surgeon highly respected in traditional dental circles for his skill and brilliance, I recently queried him about them. He rolled his eyes and scoffed. Of course, cavitations exist. To help avoid cavitations after an extraction, a dentist must follow through as though he were finishing a cavitation surgery. He or she must thoroughly remove the ligament that surrounds the tooth. Additionally, at least 1 millimeter of bone should be carefully removed with a slow-speed drill and copious water spray. If there is condensing osteitis, as with this tooth, it too must be carefully removed. There are numerous additional adjuncts biological dentists use, such as irrigating the socket with an ozonated 5% concentration of magnesium chloride, ozone gassing the socket, and then filling with a biocompatible socket putty to control clotting problems. Many biological dentists will offer vitamin C, IV, and acupuncture or acupressure following the procedure to help clear meridians. Immune system support is always recommended. And of course, it works both ways. Getting rid of root canals, cavitations, and heavy metals surely lightens the immune system's load and is a good way to start a person's journey back to health. Perhaps you have decided you must extract your root canal-treated teeth to maintain or regain health, against the clear position stated by the American Association of Endodontists. You chose a biological dentist who can help you avoid cavitations and who boosted your immune system. Many people choose implants to replace a missing tooth. Implants are essentially an artificial root screwed into your jawbone topped with an artificial tooth or used as an anchor for a bridge or partial denture. Implants are displacing root canals because they look, feel, and function very much like a natural tooth and do not interfere with normal oral activities. They help maintain bone that normally dissolves over time after a tooth is extracted. They can last a long time and do not require grinding down adjacent teeth as a fixed bridge would require. But you must remember success is not measured only by tooth function, but function within your body as a whole. There are a number of important aspects of dental implants people should seriously consider before deciding to go forward with this major investment. Some people are concerned that implants contribute to cancers, cause galvanic currents, create oxidative stress, suppress the immune system's T cells, and slow energy flow along the body's meridians. If you have trouble thinking of this energy flow as acupuncture meridians, think of it as your body's fascial planes of interstitial connective tissue. There is merit to these concerns. Read more on Mercola.com, Safer and Healthier Alternatives to Root Canals. In this article, I introduce dental material biocompatibility testing labs and labs that DNA test for microbes that inhabit root canals and cavitations. Energy medicine is the future. Once you realize that your nervous system, cardiovascular system, muscles, and even how nutrients and waste move into and out of cells are examples of electrical subsystems operating within a bioelectrical body, this starts to make sense. I introduced energy medicine when I talked about electrical discharges emanating from metal tooth restorations, and again when I discussed root canals, implants, and using negative ion generators to clean the air and improve the electrical field around our bodies. Earthing is popular because people are beginning to understand that microwaves, cell towers, cell phones, electric cars, electric smart meters, and Wi-Fi connections create energy fields around us that impair our body's ability to stay healthy or to heal. Low-level light therapy has been used by sports therapists and other clinicians for years. Called biostimulation, cold laser therapy, and more recently, biomodulation, brief treatments to damaged tissue can activate an enhanced healing response. Wounds need a threshold voltage to heal. Biomodulation helps tissues, including bone, to regenerate. Biomodulation reduces acute inflammation, alleviates chronic pain, enhances wound healing, and even makes skin look younger and more vibrant. These clearly have a place in every dental office.
Navigating the healthcare field for you and your family is challenging. As so many environmental factors threaten our very lives, it is increasingly difficult to find one practitioner who can offer the scope of care many of us want or need in any field. Collaboration between open-minded caregivers and their clients is essential. Informed consent through education is my mission. I know not everyone will agree 100% with the answers I have found. This film was merely an introduction to ideas you may want to consider. May we all benefit.